Infectious Disease Reference Guide for Designated Officers. Module 5. Exposure to blood and/or body fluid. Here are general first aid recommendations. Wounds, needle stick injuries. Allow the wound to bleed freely. Do not squeeze, rub, scratch, or cut wound to promote bleeding. Wash thoroughly with soap and water. Unbroken skin exposures. Wash area with running water. Do not rub skin or use alcohol-based antiseptics. Eye exposures. Flush thoroughly with water and leave contact lenses in. Afterwards, remove contacts and clean in a normal manner. Do not use soap or disinfectant in the eye. Mouth exposures. Spit out fluid immediately. Rinse mouth thoroughly with water and spit out, and repeat several times. Do not use soap or disinfectant in the mouth. Seeking medical attention. If a blood-borne infection exposure occurs, the emergency service worker should seek medical attention immediately to ensure baseline testing is completed and to determine if post-exposure prophylaxis is required. Baseline testing for hepatitis B, C, and HIV should be performed shortly after the exposure. Liver function tests may also be ordered. This will help the healthcare provider assessing the emergency service worker to determine if they were previously infected or immunized, and may also affect the type of post-exposure follow-up recommended. Repeat testing should be done at the following intervals or as recommended by the emergency service worker's healthcare provider. HIV, 3 weeks, 6 weeks, 3 months, and 6 months. Hepatitis B, 6 months. Some may recommend testing at 3 months as well. Hepatitis C, 3 months and 6 months. Liver functioning tests may also be done at 6 months. Repeat testing is very important for several reasons. Initial symptoms of HIV, hepatitis B, and hepatitis C can be vague or non-existent. The time from exposure to infection can vary depending on the infection and the host. Post-exposure prophylaxis are medications used to help reduce the risk of HIV transmission and is not recommended in all cases. It's up to the attending healthcare provider to determine if post-exposure prophylaxis is appropriate. If ordered by the attending healthcare practitioner, the hospital will only provide a few days' worth of post-exposure prophylaxis. It's the emergency service worker's responsibility to follow up with their healthcare provider to obtain a prescription to complete the remainder of the 4-week treatment regime. Post-exposure prophylaxis is most effective if started within 72 hours or 3 days of exposure. Post-exposure immunizations. Depending upon the type and source of the exposure and the emergency service worker's vaccination status, immunizations and/or immune globulins may be recommended after an exposure. The emergency service worker should discuss recommended immunizations with the attending and their own family healthcare provider. The designated officer should perform an initial assessment and use the emergency service worker's post-exposure algorithm to determine if an actual exposure has occurred. You can find this chart in the manual. If it's determined that no exposure has occurred, the designated officer should provide general information to the emergency service workers, including why the occurrence was not classified as an exposure, and no further follow-up should be required. If it's determined that an exposure has occurred, the designated officer should complete the emergency service worker's exposure risk assessment form, then notify the health unit of the exposure.